All right, Christy, thanks. 7:21 is your time, and as we inch closer to triple-digit temperatures, most of us are looking for ways to stay cool. Dehydration, heat exhaustion, and heat stroke can be a concern for everyone, but especially young children, seniors, and those with diabetes. Dr. Nguyen from People's Health LSU joins us now to discuss some tips to stay cool this summer. Welcome to you.
Thank you. How are you doing?
Very well, very well. Well hydrated this morning, thankfully.
That's important.
It's a danger this time of year, especially as we get so warm. What are some of the symptoms of dehydration?
So dehydration, the main things to look for are feeling very thirsty, not peeing a lot. Some people will feel very weak. Some people will have palpitations, and in extreme cases, passing out.
Wow. Okay, so we got to be watching these types of things. What are things that we can do to make sure that we don't get dehydrated?
Yes, especially in Louisiana, it's a big deal, not only because of the high temperatures, but because of the humidity. So the important thing is to make sure that you're drinking plenty of water. Usually we recommend about 8-ounce glasses of water per day. In addition to that, to avoid dehydration, avoiding extreme heat would be staying indoors during those peak hours. So really, if you have any activities to do, you really want to try to do them first thing in the morning or later in the evening, and just making sure you drink plenty of water and staying hydrated.
Yeah, I have some young kids. Yesterday, instead of hanging out outside in the afternoon as the temperature spiked to about 95 degrees, we went and saw a movie.
Yeah, for sure.
Yeah.
And it's very important, especially in young children and in elderly patients who are more prone to the dehydration.
Right, and then patients with diabetes, some very important things to remember with them as well.
Yes, so patients with diabetes, if you have high circulating sugars in your body, so if your diabetes is not well controlled, what the kidneys will do is the kidneys will try to excrete that sugar through the kidneys and into the urine, and with that sugar goes water. So diabetics are more prone to being dehydrated. That is why when your sugars are poorly controlled, you feel very thirsty, you pee a lot, and that explains it, and that's why diabetics are more prone.
And who typically comes down with diabetes?
So it can be genetic, but more recently, in the last few decades, we've been seeing a higher incidence of it tied into obesity. So it's very common. Over 26 million people in the United States have it. In Louisiana, I mean, we have a huge proportion of patients with diabetes, and an even higher number with pre-diabetes, which is that borderline sugar.
And as you say, one of the best ways to manage diabetes is really to kind of take a look at some of your behaviors.
Yes.
Watch your blood sugar.
Yes. And, if you have a family history of diabetes, or particularly if you have diabetes, you really do need to pay attention to these things. So the main thing is in the diet. So avoiding any types of pure sugars. The big thing I always tell people is no soft drinks, because those are loaded with sugars. In addition to that, staying away from dessert items, candies, all of those things. If it tastes sweet, I usually tell my patients they should be cautious of it. In addition to that, you do want to eat carbohydrates. Choose wisely when it comes to carbohydrates. So avoid white bread, white rice, pastas, and stick to the wheat and the whole grain products, and eat lots of vegetables and lean proteins.
All in all, use a lot of common sense, not only dealing with diabetes, but also as you're heading outside and it's so warm outside, just use some common sense.
Exactly, exactly.
Right. Well, Dr. Nguyen from LSU People's Health joining us this morning with some very good tips and very good advice.
Thank you so much for having me.
Appreciate it.